Hello and welcome to Back to School in the Face of a Pandemic webinar series, part number 3. In part number 1, we covered processes, procedures, and best practices to help reduce the spread of COVID-19. In part 2, we discussed maintaining healthy environments, including CDC guidelines, examples of their practical application, and implementation of those guidelines utilized by multiple school districts. In part 3, we will focus on maintaining healthy operations and preparing for when someone gets sick, including training, signage, and communication. This presentation utilizes the CDC guidelines along with practical policies from school districts around the country. In addition, the presentation shares support materials, products, and procedures to support those guidelines that can all be found on Betco's Enhanced Facility Disinfection Program. Please note that every school district has unique state and local guidelines they must follow. This presentation is designed to help school districts consider multiple options that best suit their needs and their particular situation. The CDC starts off by talking about the gatherings, visitors, and field trips policies that schools should considering when developing their academic year. They should pursue virtual group events, gatherings or meetings in lieu of field trips, student assemblies, special performances, school-wide parent meetings, and spirit nights should all be done virtually as best as possible. If the events are held, limit those group sizes and promote social distancing of at least 6 feet. Schools are encouraged to limit non-essential visitors, volunteers, and activities involving external groups, organizations, and such, especially when the individuals who are not from the local or geographic area. So if they're from out of town, especially, limit those visitors. And then, of course, pursue options to convene sport-related events and activities in ways that minimize the risk of the spread of COVID-19. Here's an example of a school system's volunteer and visitor policy. They're saying at this time, non-essential visitors are not allowed in the buildings. That includes volunteers, guest speakers, and visits by family members and lunchtime members. So no more going to lunch with the second grader and joining the class. There are several examples of some signs that they can use on the outside of the building that, again, just discourage visitors and remind people that we're trying to maintain social distancing and keep our kids safe by allowing very few, if any, visitors within our school systems. Another area is to identify and keep together small groups of kids. This is a term that probably most people haven't heard of. It's a term the schools have used for years, but it's called cohorting. And that ensures that students and staff groupings are static as much as possible. By having that same group of children stay together with the same staff all day long. Many times you have like second grade classes, they will all get together in multiple classes. Now they're going to have one second grade class that won't intermingle and mix with the other second grade class or the third second grade class. So they'll all stay within their same cohort per se. Limiting mixing and contact between those cohorts. So they're going to limit how much those classes get together. They're going to keep them separated. They're going to stagger arrival and departure drop-off times and locations for those different cohorts. To limit their exposure to other groups. You know, recesses may be at a different time. Bathroom breaks will be at a different time. Going to and from lunch, if they're going to and from lunch, maybe at different times. So avoid that crossover between those different groups within the school itself. There's an example here of a elementary school in their plan, but students will stay together as a single class and they will not mix with other classes. Teachers and students will remain in the same classroom from the beginning of the day to the end of the day. Bathroom breaks are on a staggered schedule throughout the day, so they won't all just get a go. When the bell goes off, they're going to stagger those breaks throughout the day. They're looking at music and PE classes and adjusting the curriculum so they don't involve things like singing, playing wind instruments, or avoiding indoor perspiration. So in other words, they're going to try to do as much as they can outside, but anything inside where they're exerting a lot of energy or perspiring heavily, they're going to avoid. And then, of course, recess times are going to be staggered to avoid mixing those classes or those cohorts together in common areas. Here's an example of a middle school classroom model. They're utilizing here a cohort system where students will stay together as a group and they won't mix with other cohorts throughout the day. So, you know, a lot of times middle school children will go from one class to the other, but they tend to go to different classes. Here, they're looking at saying, we're going to keep this group of kids together all day long, and they're going to go together from this class to this class to this class to this class. The teachers will remain in those classrooms, but the students will be released to go on their next class, and again, in a staggered schedule. Bathroom breaks, again, are going to be staggered throughout the day. And then they're going to adjust the curriculum for music and PE accordingly. Block schedule is very common and is finding more and more use when it comes to high schools. They will have face-to-face classes, and they will interact with those teachers daily. They're looking at moving classes instead of multiple 6 or 7 or 8 classes a day. They're going to 4 classes a day, and then they're rotating between A and B days. So it avoids kids going in the hallway and changing classes more often throughout the day. There's only 3 changes or 4 changes throughout the day instead of 7 or 8 changes throughout the day. The teachers will remain in the classrooms, and they will clean and disinfect in between those classes. And then, of course, bathroom breaks are going to be staggered throughout the day as well to avoid congregating in those small areas. It's important that every school and every facility, actually every building, have a designated COVID-19 point of contact, according to the CDC. They should designate a staff person to be responsible for responding to COVID-19 concerns, i.e. a school nurse. A good example of that. All schools don't have a school nurse, but you should at least have a staff that is designated for that. Staff and family should self-report if they or a student have symptoms of COVID-19. If they've tested positive for COVID-19 or they were exposed to someone with COVID-19 in the last 14 days. Always follow applicable laws and regulations relating to privacy and confidentiality. There are a number of privacy acts and concerns. HIPAA is always a concern, so we're not just notifying, hey, Johnny in Class B has symptoms of COVID-19. Have to be very careful about sharing personal and private information about staff and or kids within the school. But it is important to notify staff, families, and the public of school closure and restrictions in place to limit the exposure of COVID-19. Here's an example of a school policy in regards to the notification of staff. The district will cooperate with the local health department in regarding positive cases of COVID-19, so they will be reporting that. Students or staff who've tested positive for COVID-19 are excluded from school until cleared by a medical professional. So not only should they follow the CDC guidelines for a minimum of 10 days up to 20 days, no fever for at least 24 hours, but they also are requesting and requiring that they are cleared by a medical professional. Parents will be notified of the presence of any laboratory positive test or clinically diagnosed cases of COVID-19 within the school or within their cohort or class. And in the event of a positive case, immediate effort is going to be made to inform those close contacts. And that includes people within that were within 6 feet of that particular person for more than 15 minutes. So not just somebody that was passing down the hallway. Hey, I saw somebody across the way, I waved at them. No, this is somebody that was actually within 6 feet of them, and they were there for more than 15 minutes. They may be asked to be required and to quarantine for up to 14 days. Communication is one of the keys to this, and one of the ways that you can do that, not only through email and text and things like that, but also signs throughout the facility. The Betco EFD program offers a number of these. Most of them are also customizable, so you can utilize these in your facility, and it helps share information with the public as to what you're doing. and how you can get that, share that information. So, for example, here's a certificate of disinfection that you can utilize within your facility, and help share that, hey, we are following CDC guidelines. We're following the Smart Steps program to clean and disinfect our facility, keep that facility clean and safe for our kids. There's a disinfection survey that you can also utilize that shows, hey, we've checked off all the boxes. Here's where we've cleaned. Here's where we've disinfected. We've done these areas. We've followed all the steps, and we followed all of our touch points. Um, Similar to how you walk into a hotel, perhaps, and you see that Joe or Sally or Mary has cleaned your room, and hey, we care about you. This facility was cleaned and disinfected by Joe, the janitor. Okay. Um, and then finally, facilities can utilize posters and wall charts and things. So, say for example, you walk into a facility. This may be at the front door where you talk about, here's how we use the 5 steps to clean. This is what we do, and we document it. And then, here's what we recommend to avoid cross contamination and such. So, wash your hands frequently and such. So, again, available in English and in Spanish. There's a number of these different sites and posters and wall charts. Do you feel sick today? Both in English and Spanish. This is one of my favorites as well, and that is, how do you avoid the spread of contamination? And these can be posted throughout the facility. Maintain the distance between you and others. Avoid shaking hands. Cover your mouth. Clean and disinfect. Wash your hands often. Stay home if you're sick, and avoid crowded places. Okay. And then finally, of course, we talked about this earlier as well, but wall charts, those are available for proper hand washing procedures. How do you wash your hands properly? What are the steps you should go through? How long should I wash my hands? And when should I wash my hands? All important tasks of hand hygiene. There's a number of these that are also available that you can customize, add your school logos and such to those as well, and customize those. One other area, the CDC is recommending that schools look at their policies and programs when it comes to leave of absence, time off, and attendance. They are suggesting that they implement flexible sick time and leave policies that enable staff to stay home without punishment, quite honestly, when they're sick, uh, or when they've been exposed, or when they're caring for someone that's sick. Um, the old American way of, hey, I'm going to go to work no matter what. I've got the sniffles, but I'm going to work my way through it. I'm not feeling great, but I'm tough. I'm going to work through it. They're asking people to really pay attention, and because some of the symptoms are hidden in COVID-19, they are asking that people stay home on those days when they don't necessarily feel well. Doesn't mean anything, and it won't hurt you, and they won't count it against you. Leave policy should also account when employees who need to stay home for their children or childcare closures, things like that that affect family leave. And then also develop a return to school policy after the COVID-19 illness. We talked about that a few slides ago, but what are the policies specifically for returning after a COVID-19 illness or exposure to COVID-19? And then monitor absenteeism of students and employees, cross-train staff, create rosters and backups for staff. So ensure that, last minute we're able to cover a class if somebody calls in sick, they can't make it. How are we going to cover that? How are we going to cross-train so that we're able to still complete all the tasks of the day without interruption? Staff training is incredibly important, and probably as much or more so now than ever. But train all staff on safety protocols. Yes, we have a single point of contact at every facility, but all staff should be trained on those. All staff should be trained on how to recognize the signs and symptoms of COVID-19. Staff should conduct daily health checks, as we discussed in part 2. Those screenings, symptom checks for both staff and students. Health checks should be conducted safely, respectfully, in accordance with privacy laws as well. So carefully doing it in private, not necessarily in public, but how are those going to be done in schools, and ensuring that they have a good plan for that. There are a number of resources at your disposal on Betco.com. There are videos as well as Betco U that I'll show you in a moment. But there's all kinds of resources there, whether it be videos, whether it be training, whether it be training modules, or whether it's using the Betco iBet app as well that can guide you through product, procedure, and implementation guides and things like that for implementing these type of programs within your facility. If you go to the Betco website and you go to the resources section, and then eventually the Betco U section, I'll show you how to get there. It will guide you right to the a training module that can be done for all your custodial staff. It's fantastic when it comes to teaching them all there is to know about the proper way to clean and disinfect. And I'll let you listen to it for just a second here.
Betco's Smart Tools, Enhanced Facility Disinfection, is a comprehensive program that will educate, inform, and provide the highest performance cleaning and disinfection solutions for you and your team based on CDC recommended procedures, EPA-approved disinfectants, and FDA-registered hand hygiene products.
So there you can see the program itself, and it will walk you through step by step on how to effectively clean and disinfect your facilities, all the proper procedures for floor cleaning, restroom cleaning, and such. So it's a great little program. Afterwards, you can take an online test and receive a certificate of achievement after passing that class with an 80% or greater. But there's all kinds of resources available. Again, Betco.com on resources, and all kinds of resources that you can get and utilize when it comes to training your team and your staff. Now, inevitably, someone will get sick. That is probably a given, right? So we need to make sure that staff and families know how to notify the school and officials. Who do they call? Where do they go? What do they do if they've been exposed to someone with COVID-19 or they have symptoms? Okay. Individuals that are sick should go home immediately or to a healthcare facility. Okay. Work with school administrators, nurses, and healthcare providers to identify an isolation room or an area to immediately separate anybody who has COVID-19 symptoms or test positive. This is something that I find a lot of facilities miss, is that they need to have a designated area that if someone's not feeling well, if they're sick, they need to go to this particular area immediately. So, for example, here at Betco, we have a lot of different rooms and such, but we have one room that we have designated. It's called the Red Room. It happens to be a little conference room, but it's called the Red Room. And that is a designated area for all the office staff. So if anyone's not feeling well, something else, they can go to the Red Room, and we know that is a designated isolation area for potential COVID-19. But every facility needs to have something. It may be a nurse's station, so long as we educate and everybody knows where that area is. So when somebody does get sick, school nurses and other healthcare providers should use a standard and transmission-based precautions when caring for sick people. Okay, so they're going to be wearing the proper PPE, right? They are going to be caring for them in an isolated area. They're going to establish procedures for safely transporting anybody who's sick, either to home or to their healthcare facility. And then staff members or students should not return until they've met the CDC guidelines criteria to return back to school. So some of the areas the CDC is recommending is, number one, wait 24 hours or as long as you can before cleaning or disinfecting in those rooms. So say there was an isolation room or there was an exposure in a classroom, they're suggesting wait as long as you can before actually going in and cleaning. What that does is enables that air to exchange within that and reduce the contamination that's possible in that room. Now, a lot of times 24 hours just quite honestly is not feasible. So you need to go in sooner. We'll talk about that on the next couple of slides on what we can do in those areas. But then, of course, notify health officials and close contacts and anybody else that was in close contact according to school or state and local regulations. School administrators should notify local health officials, staff, and families immediately upon any COVID-19 case. And then, of course, inform anybody that had close contact with them. But the key is to close off those areas where there was a sick person, and we don't enter those areas until they've been cleaned and disinfected. Again, we talked a little bit about a quarantine room. Here's an example of a school district. They have a quarantine room that's designated in each building. It is outfitted with the proper PPE, including masks, gowns, gloves, and face shields. Each building identifies and trains a particular staff member to serve as the quarantine officer. And then any student or staff showing symptoms of COVID-19 required to wear a mask and remain in the quarantine room until leaving the school. And then students and staff must have clearance from a medical professional before returning to school. So this is just an example of a school district policy and how they are treating children and or staff when they are possible COVID-19 positive. Here's a little graphic illustration of what they will do to decide where this case is going. So say, for example, you had student A or staff B. The first question is, were they within 6 feet or more for more than 15 minutes? If the answer is yes, did the student wear a face mask? If the answer is no, they must quarantine for 14 days, okay? If the answer is yes, they can remain at school and monitor their symptoms and go home if symptoms develop, okay? If they were within 6 feet for more than 15 minutes, they were not, they can remain at school. So there again, they're trying to make this fairly simple as a little chart as to how they can stay at school, not stay at school, and what they should do. There are a number of school systems also that are looking at this and saying, hey, we're going to have standard times set up for this, so there's not a lot of questions in regard to every individual case. And so this is a simple little matrix to help them decide what they should do and not do. Again, the Betco EFD site has all this information. All 5 steps include these details and how you can work in and around all of these areas. So including product uses, different product choices, your skincare choices, whether it be skincare or hand sanitizer, as well as the webinar, and then download the frequently asked questions can also, in combination with this series, help you design a very robust program for your school system. And then finally, as I mentioned in the previous webinars, the CDC has put together a very nice readiness program and planning tool available on their site with a checklist that helps you go through to ensure you've covered all areas. And then finally, if you have any specific questions or any questions at all, you're welcome to contact Betco. You can contact us back through our website at betco.com. You can also give us a shout at any time at 1-888-GO-BETCO. And a Betco regional manager in your area will be happy to help you develop a robust platform for your school or facility. Thank you very much.